Do you suffer with knee pain? I personally suffer with knee pain, and I had to go through the process of trying to find a way to heal the knee pain so I could get my life back and get my quality of life back and actually be able to walk. And so I'm going to teach you exactly what you need to know. Hi, I'm Dr. Jason Tripp. I'm a chiropractor and a naturopath right here in Hermitage, and we have a solution for knee pain. So I'm going to teach you exactly what you need. When we're looking at knee pain, we help people to get back to their life, back to the ability to do the things they want. I find that people don't really come in for knee pain. They'll suffer with pain for years. They'll come in when it stops them from being with family, from walking, and from being able to participate in family functions or play with their kids or grandkids. And so when we're talking about getting your pain back, it's really the bigger idea is to get you to where you can actually enjoy your life again. So that's what we're going to be doing. My knee pain I had when I had the knee pain, I had a snow skiing accident, and I twisted and my ski didn't. And so it caused me to have some damage to the knee. I knew that there were 3 phases of healing. Today's video, we're going to talk about the 3 phases. We're going to stop there. But the 3 phases of healing have to do with how your body already heals. And if I knew that if I participated in the healing process, did what was supposed to be done through the therapies and through the 3 phases of healing, that I would get knee restoration and knee strength back, and I would be able to do good. But I knew if I didn't do proper therapy and it healed wrong, that I would have permanent damage to some degree, where I'd have pain, problems, damage to the knee for the rest of my life. Now, I knew I didn't want that, so I went ahead and did all the therapies. So when we're looking at how those therapies work, number 1, the repair phase, the inflammation phase, is when your body first has an injury. The second part is repair phase, when your body is now healing of that injury. And the third phase is remodel, when it's getting stronger from the injury. So let's take them one at a time. When we're looking at how the inflammation phase works, the inflammation phase is when you get that initial injury, maybe it gets swollen, maybe it gets hot, maybe it gets red, you're losing function. Heat, redness, swelling, lack of pain, or pain and lack of function is this common signs of that inflammation. Well, when you have that, there's certain therapies you do to decrease knee inflammation. And we use laser in our office. It's a cold laser that will stimulate the healing part of the body to help it to heal the knee. It adds energy to the body so it can heal better. That's what I'm trying to say. And so that laser therapy is cold. You don't feel it. There's no burning. There's no cutting. You place it, the laser's right on the knee, and it'll actually stimulate the healing to go more rapidly. It's actually a pretty cool therapy. In combination with that, we're resetting the knee back to where it goes. So chiropractic adjustment to help make sure it's not twisted still in the awkward position. In addition, we use knee decompression, which is a therapy that gently stretches the joint open to help the ligaments and the muscles to heal as it's stretching. And so it's a gentle therapy. It feels really great when you get it done. It's good for pain. So during this phase, you're doing everything you can to get out of pain. Here's the number 1 problem that I see with people who have had knee problems, is that when they do whatever they got to do to get the pain gone, get out of inflammation phase, they stop care. And that's the end. They don't have, that's it. There's nothing else for them to do. They're like, I'm out of pain. I feel good. Thank you very much. The problem is the body is still going to go through repair phase, where it's putting in scar tissue. It's still going to go through remodel phase, where it was trying to get strong, but it's not able to do it without proper therapy. So if you heal wrong in repair phase, you're going to have some permanent damage. What's that look like? In repair phase, your body puts in scar tissue. The scar tissue goes into the body and creates 4 negative effects. Even though it's a healing tissue, it creates 4 negative effects. The first effect is that the nerves are more sensitive when you're putting in the scar tissue. So the nerves get trapped inside that scar tissue matrix and they become more sensitive. The second effect is the nerves get tangled inside of the scar tissue as it's being laid down. When the nerves are tangled, they're more likely to have pain. The scar tissue is weaker by 30%, and it's less mobile. It's tighter, constricted like this by 30%. And so as you're going through repair phase, you're working on the nerves to help them to heal. So when you're decreasing nerve sensitivity, you really want to use a therapy called electric muscle stim. Electric muscle stim will decrease the nerve sensitivity. It's a mild current that feels like a massage to the knee, and it will decrease pain and inflammation and decrease nerve sensitivity. So that's one of the best therapies you can use. The second thing is for nerve entanglement. When the nerves are tangled like this, it's like throwing a mop on the ground. The fibers get all over the place. Well, you can take and straighten out that mop and the fibers go straight again. That's what happens when you have nerve entanglement. The scar tissue is put around the nerves and it makes it easier to have pain, where you can straighten it out using a chiropractic adjustment to the knee itself. And so you actually put the knee back into its better alignment, and that'll decrease that nerve entanglement. Now, if your body heals wrong with nerve sensitivity or heals wrong with nerve entanglement, that's when it's going to go permanent to some degree. For the rest of your life, you'll end up having pain. That means that you might be walking along and you have a couple good days, but you just barely twist like this. Normally it wouldn't cause somebody pain, and for you, your knee flares up and you're like, oh my gosh, my knee is hurting so bad today. Well, it's because of the weakness that's in there from the increased nerve sensitivity that never healed right, and from the nerve entanglement that never healed right. Next, in the remodel phase of care, it's 70% is strong, so we want to strengthen it. Now, how do you strengthen a scar? The adjustment on aligning the fibers of the scar tissue that I told you are crooked like a mop, those fibers, when they're straightened out, become stronger. And so as we do the chiropractic adjustment to that knee, you continue that process through the remodel care, and it'll strengthen your knee and get it to where you don't have an increased likelihood for injury because that knee is weak. You ever had your knee kind of give out on you, where you feel like it's giving out? That feeling is because of the loss of strength, because that scar tissue wasn't lined up. Also, it's less mobile, so you want to stretch the joint. Again, we use that tractioning and decompression to open the joint, and that will help to make that joint more mobile and make the scar tissue more stretchy. So those are the three phases of healing that your body's going to go through either way. If you go through it where you're doing proper therapy, like I want to do for mine, then you're going to get strength in your knees and be able to do what you want and get them healed. If they heal wrong, that's when they stay just like that for the rest of your life. We don't want that. Here's the most common problem. People will go into inflammation phase. They'll learn how to get out of pain. They put some ice on it, or they rub it, or they put some Biofreeze on or something like that. The knee gets a little better and they're like, oh good, I'm done. But what they don't realize is they haven't fixed the nerve sensitivity, they haven't fixed the nerve entanglement, and they haven't strengthened or made it more mobile, which means it's going to heal wrong, and to some degree they're going to have a permanent injury the rest of their life. Now, you may have left an old injury. You may be thinking, well, maybe I'm too late. We actually have a test that we do to find out if it's too late or not too late. It's called the Knee Pain Severity Exam. It includes a consultation with me where I talk to you about your injury, see what's going on. I go through an examination of the knee, checking two things. Number one, is the nerve in the knee already too far damaged to be healed from a natural, holistic perspective? Or do you need to go and see a surgeon about getting a surgery when it's appropriate? So the first part of the exam is to check the nerves. The second part of the exam is to check the bony structure to make sure that it's not too far gone, or there's not too much damage, or there's no bones chipped off, or anything like that. And so we do the examination. We can find out, is it something we can help? Do you have too much damage in the nerves? Do you have too much damage in the bone? If all of those are lined up, then likely we can help you. But if it's over 85% damage, that's when it's going to be too late. So we're offering our new patient special for people to come in and look and see if they can be helped. And if you can be helped, then this could be the answer for you. So I want to encourage you to come down, try out our $47 new patient exam. It includes a consultation with me, the examination for your nerve, the examination for your bone, and we'll be able to sit down and go over exactly what you can do to get back on the road again and back healthy again. Remember, it's not really about just getting out of pain, although that's awesome. It's about being able to walk. It's about being able to do things in your life, get your quality of your life back up, and play with your kids or grandkids. So I encourage you, give a call today, 724-342-2225.